Next, we have David Asher from University of Miami talking about financial education amongst radiation oncology trainees.
All right. Hello, everyone. Thanks for the opportunity to speak today. So I'll be speaking about financial education, and I'll start off by I never expected to be talking about this topic, and I had 2 children during medical school and residency, and then found out this is a very common problem that we're all kind of dealing with. And so I thought it might be helpful to intervene at our institution, and then mostly to hear what other people are doing at other institutions to see what is most meaningful for the residents. So to me, it all starts with why did you choose to be a doctor? I think many of us picture something like this, maybe on the outpatient setting versus inpatient, but, and none of us pictured this. And I think from that point, it almost becomes taboo to discuss personal finance in the medical field. And one element that used to be kind of taboo that's more mainstream now is burnout. It's kind of a very important topic. And about a third of radiation oncology residents report elements of burnout. And while it's multifactorial, it's already been discussed today, debt burden is associated with higher levels of burnout. And about a third of radiation oncology residents have greater than $200,000 in debt. And so to me, personal finance and financial wellness is an element of wellness that may be not regularly taught. So this is a survey from Medscape with over 15,000 physicians from all specialties responding. And the number one, when they were asked what would reduce your burnout, the number one thing reported was increased compensation to avoid financial stress. And as far as I'm aware, most physicians are in probably the top 10% of income earners in every state. And so I think an element of this also is just being able to manage personal finances effectively. And then in radiation oncologists, this was a survey from Thomas Jefferson from 2014 that said 75% of radiation oncology residents that responded reported being unprepared for personal finances in the future. And among those, residents that had training incorporated in the program were more likely to feel confident or have confidence in this region. And interesting, program directors agreed at a higher rate. It was like 80% of those agreed that residents were probably unprepared. So looking at our institution at University of Miami, and I think we're representative probably of the country in some respects, not to shame myself and our co-residents, but there was definitely a gap in knowledge here. None of us knew our net worth. 0 had a financial written plan. 2 people knew the difference between kind of basic investment opportunities like a Roth IRA, which may be an opportunity for residents to invest early when they're in a lower tax bracket. And then about half of us had looked into life insurance, and even fewer had looked into disability insurance. So our intervention, Dr. Raphael Yachiele in the back gave everyone this as a kind of holiday gift in December 2018. This is The White Kid Investor. It's written by an emergency room physician. There's many books out there. This was just the one we chose. No disclosures here, but we found it helpful and it's a short read. And this very timely article came out. The first author was Dr. Royce, who's at UNC Radiation Oncology, about the 4 aspects of financial independence. So we kind of distribute that as well amongst the residents. It was really well written. And very notably, it was on Twitter, it was commented on by a prominent radiation oncology group. So that brings the credibility. And then lastly, and probably the biggest endorsement, was a teaching session with a radiation oncologist that interested in this field. Not everyone has a Raphael in their department, but everyone I think has someone that might be interested in this topic. And it's pretty easy to do because the same person that wrote the book, they have this kind of free, publicly available, very short PowerPoint on personal finance geared toward residents. And this is what we talked about. It lasted about an hour, maybe 70 minutes. A lot of anecdotes from Raphael, as you can imagine, people I know, on financial literacy, loan management, insurance, Roth IRAs, the importance of written financial plan, and then lastly, just basics on contract evaluation. And these were the take-home messages that I'll kind of glance over because I know it's a format talk and I'm saying red. But just that this is another important aspect. It's an important aspect to wellness that we don't regularly discuss, that I never thought I would be discussing, but I do think it's important. And then these were some of the testimonials from residents. It was just very well received, something we'd like to do in the future. So in conclusion, I think simple financial education has potential to reduce financial stress, which can be a part of wellness. And I think in the future, what we'd like to do is be more robust in our methodology before or after to assess what the benefit of this is. And really, maybe offline, if we have time to discuss what other people are doing in their institutions to not reinvent the wheel, to see what's been successful that we can do together. So thank you.